Welcome back. Season 3 of Let's Be Perfectly Queer. Can you believe it? It's been a while, and I'm happy to be back live with the folks at Rogers TV. On our very first episode of Season 3, finally bringing to you, folks, the story of the InclusHIV Care Clinic that was opened in April of 2021 here at the Gilbert Centre in Barrie, Ontario. And to talk a little bit about that are my two guests, our resident doctor at the clinic, Dr. Ravinder Dhillon, and our wonderful nurse, Carla. Welcome to the show.
Thank you. Thanks for having us.
Thanks for having us.
My pleasure. I've been wanting to do this for a while. The clinic opened in April of 2021. This was done as the result of our lovely COVID pandemic. Prior to that, the Gilbert Centre had run a once-a-month sexual health clinic called George in conjunction with the Simcoe Muskoka District Health Unit. Unfortunately, when COVID hit, that meant that all sexual health sort of went to the wayside because they had to sort of redeploy resources to look after COVID, which is totally understandable, but it left a lot of folks in our community looking for, where do I go for my sexual health? Our last George clinic was in February of 2020, and as I mentioned at the start of the show, we opened this clinic in April of 2021. So we went almost a year without really having anywhere that folks could go locally to get sexual health resources that were badly needed. One of the reasons why we pushed to open the clinic and develop the space here was the rise in STI rates. Even during the course of the pandemic, when we were told to socially distance and not get close to one another, as we learned in the HIV pandemic, that's not how it works. That's just not how it works. And we've seen a rise in syphilis rates in particular. 2019, less than 10. 2021, we had 50 cases in Simcoe Muskoka. And there was also a rise in gonorrhea rates by, I think, double or 3 times what they were from 2019 to 2021. So definitely a need to have this service around. And I want to talk to you both a little bit about how you got involved in the clinic and why you feel it's important. And then maybe we can relay some stories to the folks at home, to some of the successes that we've seen at the clinic. Because I know we've had a few folks who have come through our doors that might not otherwise have been able to receive the service and the care that they are getting now, if not for the fact that the Gilbert Centre opened the InclusHIV Care Clinic. I speak from a very privileged position of not only working at the Gilbert Centre, but I have been tasked with managing the InclusHIV Care Clinic as well. So I get the opportunity to book the appointments. I get the chance to have first contact with folks when they are coming into the clinic, as well as follow up with their results from the testing that we've done. So it's been really rewarding for me. And I'll start with you, Ravi, because you are one of the OG. Carla joined us a little after the opening, but both yourself and I have to mention Devin Turner, Dr. Devin Turner, who unfortunately wasn't able to join us for the interview today and actually had to pull back from doing the volunteer work that he does here at the InclusHIV Care Clinic, again, because of the pandemic and being redeployed himself to more work at the hospital. We are, fingers crossed, hoping that Dr. Turner will be back in the new year to join us. In the meantime, we are looking for a replacement. So any doctors out there that would like to volunteer at the InclusHIV Care Clinic, call me. But Ravi, tell us a little bit about how you became involved in the clinic.
So pretty much I think it all started with my first patient that was HIV positive, and I had taken over from a previous retiring doctor. Now, when I started to look into that patient wasn't on any antivirals and didn't understand the importance of being on antivirals, and there was no follow-up done. So I took the liberty of learning about HIV primary care, and that's how I got involved with HIV primary care. And I met with the patient, we put her on antivirals, she became undetectable, and a lot of education, as well, because some patients don't know, what HIV can do to their body if they don't, go on antivirals and become undetectable. So that's how I got involved with HIV care, and then from there I started getting referrals for patients who living with HIV, and I started to learn more about it. I taught myself a lot as well. I networked with some individuals who were practicing HIV primary care, and I was able to gain that skill, so I felt comfortable acting as a referring service for the Simcoe Muskoka area to act as to practice HIV primary care. So then, coincidentally, at the same time, you had approached me saying, hey, do you want to start a sexual health clinic? And I was like, this is amazing because this is exactly what I want to do.
The stars aligned.
Yeah, and it was just all at the same time. And I've always wanted to do some community outreach work as well, in addition to my current work. And so I was like, hey, this sounds great. So we met, and we had the vision, and your vision was definitely executed, because one by one we started to get more people involved. We got Carla involved. We've got Dr. Turner involved as well, and we have a really good system going. And just seeing that grow from, I remember it was just me and you to start with, and me and my laptop trying to figure out a system of how to order tests or when to order it. And
right, yes.
It was definitely a learning curve, but we've gone from there to such an established clinic now and helping so many people out there. And that's what really gives me purpose and fulfillment, is that I know that I'm not only helping people get tested for STIs, but also acting as something that's missing here in the Simcoe-Muskoka area for patients living with HIV.
Yeah, and I mean, after almost a year and a half of our doors being open, we're actually starting to get more and more referrals from outside sources. So while this is really the first time we've done any sort of public acknowledgement of the fact that we are here and have a clinic open, and hoping this will get even more referrals to us, even just as quietly as we've opened this clinic and run it so far. I mean, our clinic, generally every Wednesday that we have a clinic, we are fully booked. I think we've got one spot left that I can possibly book someone for next week. So that's fantastic. And I think, for me anyway, certainly as someone living with HIV, and it's not just about HIV, but that's the reason why we called it the inclusive clinic, and spelled inclusive with HIV, because we want folks to know that there is a spot that you can go, that you can get HIV testing done without any judgment, without, a safe space for folks, regardless of their sexuality. We are the Gilbert Center, and a lot of folks are nervous about coming in because we are seen as this 2S LGBTQ plus organization, which is important. But I think we've shown, and our clients that come into the clinic, we see every race, every ethnicity, every sexuality under the rainbow, which I think is absolutely wonderful, and a testament to the work that you folks do, because all I do is input names and print off labels and say, here you go. It's what happens behind your office door and in the clinic space that really makes the difference. And I hear that from the folks when I call them and give them their results a week later, and hear that they had such a great experience at our clinic and are telling other folks about it. And Carla, you came on board a little after the fact in January of this year. What was it that made you decide that this was something you wanted to do?
Right. I didn't even know that this clinic, and I'm sure as many people didn't even know that it existed until Ravi had said, hey, we're doing this exciting thing. We're opening this clinic. And I said, do you need a nurse? I don't think you had a choice. So I was excited about that. It's a different area of nursing for me. It's fun. It's also a safe spot that, people can come. There's no judgment. I think it's a lovely, I feel privileged to be able to offer this care here.
Yeah, I'm the same way. And maybe, can you walk us through a little bit about what that care looks like for someone coming into the clinic, somebody that hasn't been to a sexual health clinic before, an idea of what that time, from the time they walk in the doors and I sit them down and let them know they're here, what happens next?
Absolutely. So they get to come in and sit with you first, which I think is lovely, because I think you firstly just make everybody feel very comfortable.
I try.
And then they go in and they sit with Ravi or Dr. Dhillon, and they discuss their needs or whatever it is that they're looking for. And then they come in and they see me. And then we can do their blood draws, we can do their swabs, we can talk about whatever. Usually we'll have a good laugh, because that's important as well. And then we send them on their way.
Yeah, and I'm glad you mentioned the blood draws, because that was another real asset to having Carla join our team.
Definitely.
Because it was something that we wanted to do right from the beginning, to avoid folks having to necessarily go to a Life Labs after coming in to see us. We wanted to have sort of a one-stop shop. And until you joined us, we didn't have that ability.
Right.
So to have you on board with your nursing skills and your phlebotomy, to be able to actually draw blood on site, and along with the swabs and the urine samples and every other sample that we take, has been really comforting to a lot of folks, because there are barriers to some folks to be able to get that additional care outside of our doors if we can't do it on the spot. Some international students or some folks who for whatever reason don't have an OHIP card.
Right.
And that's one thing that I think is really important, that we make sure that folks get the care they need regardless. You know, obviously, if we can get a no-hip card, we want to do that. But you know, we do a lot of outreach for folks within the Gilbert Centre that are street involved and don't have that luxury. And to be able to still see folks like that and offer them care, not even just necessarily sexual health. As a primary care physician, you're able to do more than just sexual health for folks. And that is huge for the community that the Gilbert Centre as a whole is looking to help. So I think that's important that folks realize that this is, while we want to focus on sexual health at the InclusHIV Care Clinic, it doesn't have to be just that. You know, if folks are street involved and trench foot and things like that are common with folks that are living rough, we can help you out. And I think that's important. We talked a little bit before we started taping about some of the, you know, the feel-good moments that we've had over the last year and a half of having this clinic open. And I wonder, obviously without naming names, can you give me some highlights that you've experienced for folks that you've seen within the clinic? And I know I had a conversation with Dr. Turner a few months ago when we were running the clinic as well, and after the patient left, he came into my office. He's like, you know what? If not for us being here doing this work, that individual going to just a regular walk-in clinic in our city, they wouldn't have known how to help him. Yet, by coming in here, we were able to get them resources and referrals that a clinic elsewhere might not be able to provide folks with, and I think that's every evening that we leave here on a Wednesday night, I leave with this, I'm on a high. And it's a natural high, which is usually unusual for me. But at any rate, that's a whole other show. But give us a couple of stories about some of the successes that you've had with folks coming in to see you.
I feel like a lot of the successes I had and just that rewarding feeling of being able to help someone was with our refugee patients that came in. We did have a handful come in on the basis of they were escaping their country because they identified as gay or lesbian or bisexual, and they were fearing their life, and so they had to come to Canada. They came here, they weren't on treatment, their viral loads were high, and they needed access to care. And so that's how they were brought into our clinic and reached out to you. And I feel like that was amazing because just kind of doing that outreach and getting them connected to our clinic was the first step into helping them. And then from there, then they went and they came and saw me. And I remember, you know, seeing their viral loads and not being on treatment and then not knowing what to do or how to access a doctor. And I was like, look, I'm here for you. We'll take care of it, right? And so with many of these handful of patients, I've taken their viral loads and they've become undetectable in months. And now they're living long, healthy lives. They feel amazing. They have access to medications, treatments, and they get access to a family doctor because I always take on those patients afterwards as well. And then my other patients who have been lost to follow up, either their doctor has retired or moved, they still need kind of follow-ups and access to care as well. And I've accepted all of those referrals that have come in. I've never denied anything, no matter how full my practice was. My passion is for HIV care and helping those living with HIV. So I always take on referrals, no matter what.
And I just want to interrupt you here because I have to make this point, as certainly as someone living with HIV and someone privileged living with HIV, I have a primary care physician, I have an HIV specialist that I see in Toronto, but there is a lack of that for folks who are living here in Simcoe that can't go to Toronto to get care. And when you told me that anyone living with HIV that needs care, you would take them on as a patient regardless, I try not to cry on this show, but you have filled a void that you've helped so many people. I don't even know if you realize how many people that you have helped, and I know you'll be able to continue to help. And that is huge, especially for this area where we don't have a specialist. And quite frankly, the specialist that was in this area isn't someone that I was referring folks to anyway, because I went to them when I first moved here and did not like the fact that they would not give me a concrete answer. Because I point blank asked this individual, when your patient is undetectable, what do you tell them, you know? And he danced around the idea of being able to tell them that they are zero risk and unable to transmit the virus sexually if you have an undetectable viral load. And I was like, you know what? Renew my prescription and I will find care elsewhere. Because this, for me, and for many people, and I think you'll agree, the idea of being undetectable means that you cannot transmit the virus sexually. That is the cornerstone for being able to end the HIV pandemic. It really is. We can end HIV if folks know that. 14% of Canadians are living with HIV and they are totally unaware that they're living with HIV. And we need to make sure that folks know that there is treatment available that allows you to live a long, healthy life with zero risk of transmitting the virus.
Definitely.
I mean, I'm in the best shape and healthier than I have ever been in my entire life. And part of that is the reason behind it was the clinic. Knowing that I was going to sort of be the face of the clinic for folks coming in, especially folks living with HIV, I wanted them to see that this is what HIV looks like in 2022. You know, and this isn't the only face of HIV, but this is a healthy face. And the number of people that say, well, you don't look like you're living with HIV, I'm like, you don't know what people look like who are living with HIV. So there's that stigma that we have to address as well. And you're doing an amazing job of letting people feel comfortable and safe in that they have somebody that actually cares about their care. And for that, I will be eternally grateful to you.
Thank you.
So thank you for that. Carl, I know we've had a couple of really cool experiences with folks that have come into the clinic.
We have.
And have left. When those folks walk out of the clinic doors, you and I just look at each other and these big smiles across our faces. And tell me a little bit about some of those experiences.
I think some people who have been reluctant to look for care or look for testing, or and it takes a little while I know they've spoken to you and then haven't been able to make it in, and then have spoken to you and have booked an appointment, and then finally got in here and realized that this was an okay thing. There wasn't any judgment. It was a safe place to be. And then when we finally got them tested, the relief that came from them is, I think, is a wonderful thing. It's wonderful to see too.
Yeah,
and also on top of Ravi's, so when his HIV patients come to him, I also work with him in his clinic. So you'll see us here, but then also that continuity of care where you'll see us. So that's, I feel, maybe is a little comforting as well.
Absolutely. Yeah, no, I think that's fabulous. That's fabulous. And I hear that from patients that originated here and have become your patients that still come in here for whatever reason. It's easier for them to get in here than to go to the clinic in Innisfil. And that's comforting for me too, because it makes it so much easier for me to refer folks to you that do come saying, I need care. And I can't even count the number of folks that have run out or lost their HIV care specialist in this area that I'm able to very confidently say that, you know what, we got you. You know, I can either hook you up and have you come into the clinic and do a meet and greet with Dr. Dhillon, or we'll set you up so you can go to Innisfil, whatever's most convenient. I like it when they come in here first and do the meet and greet, because then they get to see our space and we get to connect one-on-one, especially now that we're sort of easing off some of the pandemic restrictions and we can see faces and talk to people in person again.
And build that relationship of trust.
Absolutely, yeah. And the story that you were talking about, this individual, she had been a victim of a sexual assault a number of years ago and had not had any sexual contact since, and had been worried for, I think, 5 years since this happened about the fact that they might have been possibly living with HIV, and they have a child and weren't sure how to talk to them about that. And this individual contacted me through the work I do at the center and scheduled a time to come in. They didn't show up. Then the second time we scheduled an appointment with them, they came in and sat in my office forever and had a conversation and still didn't come in and see anyone. But that third time, when she did finally come back in, we got her into the office, and she asked me to stay with her while you performed the point of care test, the HIV point of care test. And the look, she was terrified, absolutely terrified. And I knew in my heart from the stories that she told me and the way that she relayed what happened that the likelihood of her actually testing positive was very small. But she was absolutely terrified. It had been for more than 5 years, that fear of what's going to happen to me if I'm living with HIV. I mean, that talks a little bit about the stigma as well. But in this situation, for us to be able to do that point of care test, that literally, less than a minute, the results come through on an HIV point of care test. And to be able to turn that test around and show her that single dot that indicated she was HIV negative, and the change in her expression,
yeah.
I'll never forget it.
Yeah.
Never forget it.
Yeah.
And she has continued to remain in touch with me because she really wants to get involved and volunteer at the center when she can. She's asked to make sure that anytime I'm speaking somewhere that she knows about it so she can be there to support. And that to me is the number one reason why I do the work I do and why we had to open this clinic.
Yes.
Definitely.
What do you see moving forward? What else do we need to do at the clinic that we're not doing right now to be able to even expand our services more?
I think expanding our services to contraception and then also abortion as well, I think is really important. If someone out there offers services for abortion, we would love to have you. I feel like that's such a huge need as well, because I know there's a lot of patients in the Simcoe Muskoka area that have to go to Toronto for their abortions. And it's just unfortunate. Some of them, they can't access transportation, or there's barriers to that. And so that need is required here, and I feel like that would be our kind of future that we should start to aim for as well, to kind of expand our services to contraception and abortion as well.
I'm glad you mentioned that because already working on it.
Yeah, that's awesome.
We do have some connections that we've been working on and talking with. Gosh, probably about a year now that we've been working on this. So we're getting closer. It's something that I need to do some more follow-up on as well. But yeah, and I'm glad to hear that you're supportive of that. I knew you would be, but I didn't want to really go into a whole lot of detail until we had more concrete information. But it is something we are absolutely working on.
And in the time being, like, we have a colleague that we work with that does do oral abortions, oral pill abortions, and that's someone that we can refer to as a resource in the meantime until we have someone kind of join our team.
Right.
Yeah.
Wonderful. Wonderful. Any thoughts from you, Carla, on what additional services you see as a need for us to maybe try and introduce?
I know that you had spoken before about being able to do the PrEP blood work. I don't know if that's something that we could also, I think, that way come in, we'll get your blood work done, we'll do your one-stop shop, and away you go. And yes, absolutely, the contraception and abortion services, I think, are important.
And I feel like we kind of already offer contraception anyways. I have some patients that come in for Depo-Provera. If they need a prescription for birth control, we offer that too. Like, I feel very comfortable doing that. I've done it many times now. So I think it's more so the abortion, and definitely the PrEP labs would be a great addition to our one-stop shop, kind of keeping everything convenient in a sense. Definitely.
Yeah, and while we're on the subject of PrEP, I also want to send a shout out to Andrew Shambi, who was very helpful in the initial stages of us setting up the clinic. I think maybe the first night that we actually had clinic open, Andrew came in with Achilles, his little puppy, and gave us a run through of what he does very successfully at the prevention clinic in Toronto, and what he was doing here in Barrie while he was here. And to be able to have input from Andrew on, this is he gave me an idea of what refrigerator we needed to have, and gave us a first sort of rundown of the supplies that we would need to have. And I think Andrew might be a good resource for me to reach out to find out exactly what we need to ensure that we can get all of the proper lab work done for PrEP, so that we don't have to send folks to Life Labs for additional blood draws.
Exactly.
Because that, again, can be a barrier for some folks.
And I think, just having the courage enough to come here for your testing and then go, well, we're almost done, but now we need you to go somewhere else.
100%. Yeah. That is huge to be able to, and that was sort of the clunky part, I think, of our clinic initially, was not being able to have you. I mean, you really did sort of
grow it.
You sort of made everything gel for us by joining our team.
Definitely.
I'm honored.
And it's, I absolutely love my Wednesday nights when I get to work with you folks. It's great. And I remember when we started, we were doing every other Wednesday night and every other Friday morning. Because Dr. Turner was doing Friday mornings. And that was that didn't last long, because Friday mornings, nobody's getting up early to come to a clinic. So it wasn't happening. Wednesday nights were always hopping. And that's when we had our original George clinic. So instead of doing every other Wednesday and every other Friday, we just went with every Wednesday night. Sadly, right now, until we can find a second doctor, unless you want to do every Wednesday night. I know I don't want to do every Wednesday night. We have to go less clinics, unfortunately. We're still doing more than we did prior to the pandemic, when we just had the once a month. We still have 2 or 3 clinics every month, which is wonderful. But I think there's still that need, because we're seeing these weekly clinics are filling up, weeks in advance. I'm already starting to book for the next week that we have open. And I think if we can get back to the every week routine that we were doing, that's going to be extremely helpful. I know you're both actively recruiting and looking for colleagues that might be willing to join us as well. So I thank you for that. We do have to wrap things up, so I'm just going to pass it over to each of you for final reflections and thoughts on the clinic and the work you do and the needs in our community.
I just absolutely love our Wednesday clinics, and it's something that I've wanted to do for so long, and thank you for making it all happen, because without you...
It wasn't just me, it was a Gilbert Center initiative.
Without you and the Gilbert Center, initiating it all, and then it growing into this, it's such a beautiful thing to see, and I'm so glad that I'm in this line of work, and I'm glad to help people out and know that I'm making a difference. It really makes my job fulfilling as well, so... I just want to say thank you, and thank you to the Gilbert Center.
Thank you, Ravi.
Thank you. I'm honored to work with you both, and I enjoy every Wednesday night because we have some laughs and we give good care to people who need it. This has been a wonderful learning experience for myself as well, so I thank you for having me. I look forward to just moving forward and giving more people, the wonderful care that we're giving them now.
Absolutely. Yeah, bigger and better. And one of the nice things about having this clinic space available now too is we've been able to do more than just our weekly clinics. We've been able to partner with the Simcoe Muskoka District Health Unit and provide monkeypox vaccine clinics, which has been a godsend to folks in our area, because to have to go to Toronto to get the vaccine was just a nightmare. And we have had, I think, 4 very successful clinics so far, with one more scheduled. Whether we do more in the future, that's up to the health unit and if there's a demand. But certainly initially I was getting a lot of calls saying, where do I get my vaccine? Where do I get my vaccine? And Toronto's the best place I can offer to you. But to be able to actually have that service available here for folks has been great. And that's another thing we wouldn't have been able to do if not for having that clinic space available. So it's
Very
wonderful. That's it. Can you believe we are done? Episode 1, Season 3 of Let's Be Perfectly Queer. I am so glad to be back doing this. I'm so glad to be doing this in person as opposed to via Zoom. I want to thank my lovely producer, Deanne. Love you to death. Working with you again is just one of the joys of my life, just like Wednesday nights with you two is. And I'm a happy man because of the people that I get to work with and the work that we get to do to help folks in our community. So thanks for joining us on Let's Be Perfectly Queer. Tune in again for another episode here on Rogers Berry.